Dr. Terry Denine, nurse practitioner and founder of Avexius Health Solutions and the Avexipel hormone pellet method. I'm excited to share with you today some dispelling some myths and misconceptions about hormone replacement therapy. Practitioners and lay people, patients, have a lot of misinformation about hormones. It's very confusing, and I want to clear a lot of that up. So if you're suffering from some of the symptoms of hormone decline, you will know that there are options for you that are safe and effective. So the first thing that I want to just say is I love this quote by Hippocrates: the greatest medicine of all is to teach people how not to need it. Wouldn't it be amazing if we could understand and teach preventative medicine so practitioners like myself are just not that busy? That would be amazing. And just treating acute issues, acute illness, and not spending so much of our time in chronic disease. That's a big passion of ours at Avexius Health Solutions, and our Avexipel providers across the country are equally passionate about treating the root cause of disease. And understanding what's the difference between treating and healing. Well, when you treat a symptom, or when you treat something like a disease, like a chronic disease, when you're just treating it, the context of that disease actually remains the same. But when you actually heal and get to the root of the problem and heal the root problem, remove the cause of the root problem, the context completely changes. So a key concept to understand that we love to really share with our patients and all of our providers is this difference between treating a disease process and healing a patient. So treating and healing a patient. Root cause versus Band-Aid. In the context of talking about hormone therapy, understanding that our cells in our bodies actually adapted to natural hormones. They work better with our own hormones that our bodies make. But as we have hormone decline, as we age, and we're trying to replace and optimize our hormones, we don't have receptors, and we don't have cell receptors for synthetic hormones. That's why synthetic hormones, although can help with a lot of symptoms, don't always get to the underlying and treat the root cause. And understanding that bioidentical hormones, which is what we're going to be talking primarily about today, is it's kind of like a lock and a key. So sometimes when you get a lock and you put it or get a key and put it in a lock, and it fits in the lock, but it doesn't turn the lock and open the door, right? That is kind of how the hormone receptors act in our body. Bioidentical hormones actually fit in the lock and turn and open up all of the beneficial effects of hormones beyond symptom relief. Effects like preventing heart disease and cancer and Alzheimer's disease and depression and some other things we'll talk about. Whereas synthetic hormones are like a key that gets in the lock and kind of gets stuck. It fits in the lock and it helps with symptoms, but it doesn't really help with prevention of disease, and it hasn't been shown in many studies to treat root cause of disease. So understanding that drugs treat symptoms of disease, and considering what we're talking about in this talk, menopause and andropause being this life change that happens to men and women, rather than getting to the root cause. So when we're talking about hormones, which ones matter? Well, my favorite is testosterone. Progesterone is a profound hormone for women, not for men. For sure. Estrogen, amazing hormone for women and men. You'll be surprised. Vitamin D, that's a hormone, and it acts like a hormone in the body, and our hormone receptors need vitamin D to work optimally. There is a huge connection between low vitamin D levels and low testosterone levels, and an increased risk of all cause of death. So they work together. They work synergistically is a great example of that. And thyroid's another very important hormone that I'm not going to talk about too much today, but just understanding that Avexipel providers are very well versed in thyroid optimization. So many of patients are walking around across the country with suboptimal thyroid because their thyroid tests were normal. How many times have you probably as a patient heard your thyroid tests are normal, yet you have cold hands, cold feet, thinning hair, you have depression, you have fatigue, you can't lose weight. Those things are symptoms of thyroid deficiency. But when your thyroid tests are normal, unfortunately, you're not a candidate for optimization in most offices, but Avexipel providers are very well versed in optimizing thyroid. So how do you feel? Well, we often feel when our hormones are out of balance. And when I talk about hormones, I could be talking about testosterone, estrogen, progesterone, thyroid. We feel bloated. We can't lose weight. We feel very depressed. Moody, anxious, irritable, but depression is a very big symptom that affects men and women, especially women in the perimenopausal years. Anger, mood swings. I've had patients tell me, I don't know what's wrong with me. I'll just be sitting there happy and the next minute, bam, I'll just be so angry and biting people's heads off. That's hormone fluctuations, and that can actually be fixed. That's good news for a lot of you husbands out there, right? So depression, anxiety, irritability, mood swings, brain fog, can't sleep, can't focus. Falling asleep at night, not typically a problem, but staying asleep through the night, a big problem. Can't lose weight, joint pain, can't build muscle, decreased recovery after workouts. The list goes on and on, but a lot of these are very familiar symptoms that we suffer from, and we might go visit our primary care providers, but nobody's really looking at hormones as a root cause. Unfortunately, what happens is we get band-aided with medications like anxiety pills, antidepressants, sleeping pills, and my favorite is all the ADD meds for adult ADD, that is basically prescription speed, right? But I just don't think that we are deficient in these chemicals. They're Band-Aids, and medications are excellent for addressing an acute illness or to get us over a hump during a time of depression or anxiety or difficulty focusing until we figure out what the root cause is. And I just will say that I don't believe the root cause is a Prozac deficiency or a Xanax deficiency or any of those other medications, Ambien, some of the sleeping pills. We got to figure out why are these things happening. We can Band-Aid those symptoms for a little while, but those were not meant to be on forever and ever and ever. So many patients come into our clinics across the country and have been on antidepressants and sleeping pills and anxiety pills for many, 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 many years. And unfortunately, the root cause of the problem wasn't fixed. So let's talk a little bit about this menopause. So hormone imbalance, I don't even like to use the term menopause because menopause actually refers to one specific day in a woman's life where she has gone 12 full months without a menstrual cycle. So it's only one day, but unfortunately we use this term as a catch-all term to refer to this time in a woman's life where her hormones are declining, and then gone, and then post-menopause. So in this decline years, it's actually not that we're so much declining, it's we're fluctuating in perimenopause. We're up, we're down, we're up, we're down, we're up, we're down, right? And that's what causes all those mood swings. Perimenopause can last 2 to 8 years. For some women, it starts in their 30s. For some in their 40s. For some very lucky women, it doesn't start till their 50s. And this is a time of extreme mood swings and depression and anxiety and weight gain and belly fat weight gain. And we just don't know what's going on. But because women have menstrual cycles during that time, it throws a lot of healthcare providers off because they think, well, you can't be in menopause because you're still having a menstrual cycle, because menopause means pause in menses, right? So understand that if you're one of those patients that have been to your regular primary care provider and you've suffered from these symptoms and you were told, well, I don't know, you're just probably stressed out, take this antidepressant, take this anxiety pill, here's something for sleep, that you actually might be suffering from a hormone deficiency. Now, andropause is the male equivalent of menopause, if you will, and it's where simply a male's hormone levels decline as he gets older as well. We're seeing andropause in younger and younger men for many, many reasons. A lot of it is food, a lot of it is head injuries. There's a big correlation between head injuries and low testosterone. But by and large, most men start this decline in their 40s, and by the time they're in their 50s and beyond, their tank is pretty empty. For men, this andropausal deficiency and this andropausal decline really can set them up at risk for heart disease and Alzheimer's disease and prostate cancer. Testosterone is very protective to the prostate, unlike what we kind of think is that, a man gets prostate cancer and oh, you got to go off your testosterone. Well, that's not because testosterone causes prostate cancer. It's just that testosterone can aggravate, historically has been shown to possibly aggravate an existing prostate cancer. And I say that now because the thinking around that is actually changing, and there's a lot of urologists that are looking at utilizing testosterone in men still, even after a prostate cancer diagnosis, and it's very promising. But it's very common, andropause, in men with diabetes, high blood pressure, sleep apnea, and many other chronic diseases. And like I said, very linked to, highly linked to early heart disease in men. The hormones, let's talk about the different hormones. So the word hormone in the Greek means I arouse to activity, and that makes sense because when we don't have them, we don't want to be active, we don't want to get out of bed, we just want to stay asleep. But when we feel good, we're ready to take on the world, right? And there are receptors for hormones, especially testosterone, in every single cell in the human body. Our whole body is rich with these receptors. But we're going to talk about estrogen first because it is a woman's most important hormone, theoretically. I think a woman's most important hormone is actually testosterone, but it does have over 400 functions in the human body. It plays a role in decreasing cholesterol levels, increasing energy and vitality. It has a huge effect on brain health, cognition, memory, heart disease prevention. That's huge. There are hundreds of studies to show estrogen to be protective to the heart, protective to the brain, decreasing Alzheimer's disease, dementia, sexual dysfunction, sleep problems. So it's not just about hot flashes. And that's the biggest takeaway that I want you to understand, that although some women suffer from hot flashes when estrogen declines, that is not the end all be all. Estrogen plays a huge role in chronic disease prevention, especially heart disease. Heart disease is one of the most underdiagnosed in women because women don't present with the classic, crushing chest pain. Women have very vague symptoms when they have heart disease or even having a heart attack. They just sometimes might feel tired or nauseated. So a lot of women go undiagnosed and unfortunately die. But what we do know is women that do not get hormone replacement therapy, do not get estrogen therapy, they have a much higher risk of dying of heart disease postmenopausally than women who do actually get hormone therapy, estrogen hormone therapy. And the other thing that we know is women who stop their estrogen therapy abruptly actually have a very high risk of death in that first year after they stop. So estrogen is very protective to the heart, very protective to the brain. There's a lot of studies that show estrogen plays a role in recovery from stroke and prevention of Alzheimer's disease and so forth. I can't talk about estrogen without talking about a woman's greatest fear when it comes to hormone conversation, and that is breast cancer. Its providers are very fearful of it too, and it's because of the Women's Health Initiative trial, unfortunately reported that hormones cause breast cancer, and there was actually only one hormone that has ever been implicated in breast cancer, and that is synthetic progestin. That is not a progesterone, that is not testosterone, and that's not even estrogen. Actually, the women in the Women's Health Initiative trial in the estrogen-only group had decreased breast cancer risk. So hormones, estrogen does not cause or increase breast cancer risk. Only synthetic progestins have been shown to increase breast cancer risk. In fact, testosterone has been shown to highly decrease breast cancer risk, even in breast cancer survivors. So we really need to, don't throw the baby out with the bathwater. Don't be afraid of hormones. They don't cause breast cancer. They don't increase breast cancer risk. And we treat many breast cancer survivors in our practices across the country. So what does it feel like when a woman's estrogen is low? Well, she can have anxiety, she can have hot flashes, she can have mood swings, headaches, migraines, increased vaginal infections, increased bladder infections, joint pain, dry skin, bloating, that belly bloat, depression is a big one, and memory lapses. But testosterone is my favorite. It's the powerhouse hormone. It's amazing for men and women. The female ovary actually makes testosterone. The male testicle is the primary producer of testosterone, and a little bit comes from the ovaries in both males and females. But even though estrogen has over 400 functions in the human body, testosterone is highly, highly linked to so much disease prevention. Women actually make more testosterone across their lifespan than estrogen. That's a fun fact. There's thousands of receptors in the area of our brain for testosterone that's responsible for mood and thinking and focus and mental clarity, major symptom relief, bones. So many studies show that testosterone, and estrogen too, protect the bones, protect the heart, protect the brain, protect the breast, but most importantly, relationships. I always tell patients, if you're depressed, moody, anxious, irritable, can't sleep, can't focus, and you're not having sex with your partner or spouse, that's kind of a deal breaker. When you're moody all the time, there are so many problems with relationships that we've seen with our patients that were fixed. Life-changing relationship restoration with getting hormones optimized. So I think that's one of the biggest tangibles of hormone restoration and balance. Benefits of testosterone also include heart disease protection, decreases the bad cholesterol, increases HDL, the good cholesterol, increases lean muscle mass for sure, energy, vitality, heart disease, all of these things we've talked about, prostate cancer prevention, breast cancer prevention. Many studies show this. There's medical studies that conclude. Also plays a huge role in sexual dysfunction, obviously. Low libido, low sex drive, big problem as women age. Men don't typically lose libido. That's the very last thing to go. They can, but a lot of men think because they have a sex drive, their testosterone isn't low. So don't fall into that trap because that's not actually true. And ladies, don't think because your husband gets his testosterone levels optimized that he's going to have a higher libido. It doesn't work that way. But women always lose libido, and that's a big indicator, and it's a great area of relationship health for women when they get their testosterone levels restored. So what's normal? Well, first I want to tell you, there is no established normal reference ranges for men and women. And when men and women have suboptimal levels, all of these symptoms you see on your screen that we talked about can be present and are present. And those symptoms start hitting for males around 400 to 500 on a total testosterone, and for females around 40 to 50 on a total testosterone. So men and women start feeling symptoms when their levels fall below 550. And there's a lot of misinformation about testosterone in women. It's not going to masculinize women. It's not going to cause voice changes. It doesn't cause, all kinds of sexual changes. Women don't turn into men because they have their testosterone levels optimized at all. I always give an example. I've been on the therapy testosterone for over 10 years, and I feel like I'm still pretty much a girl out for most, for all intents and purposes. But this is a great article that a physician released, and it's public access. It's a really good one that really dispels a lot of those myths and misconceptions about testosterone in women. So like I said, men lose. They can lose up to 10%. I think it's higher than that now per year after age 30, 35. I'm seeing it younger and younger. Practices across the country. We have physicians and nurse practitioners and practitioners tell us all the time where they're seeing younger and younger men in their 20s with really low testosterone. There's a lot of theories around that. But my point is, don't just look for it in your 50-year-olds. It can happen way before that. Women, we start losing it after that second baby. I don't care if that second baby is when you're 20 or 30 or 40. When women have that second baby, something happens that all this testosterone just kind of stops producing. And women invariably all the time say, I never felt right after that second baby. I never got my body back. I never got my libido back. I never got my energy back. I never got my vitality back. So it can happen. We can lose a huge amount of our production every year after age 30, but something happens after having babies that really messes that up for us. But for optimal for females, what we've found experientially is anywhere between 80, and I think that's on the low end, but up to 200, maybe even 300. Everybody's different. So many studies that say that you cannot correlate a lab level and symptoms, because some patients come in at a level of 100 and feel amazing, and some patients come in with a level of 100 that feel terrible. All right, so same thing for men. Most men feel the best around 1,000, 1,100, 1,200. So understand that probably the test that you've had in your clinical practice that you were told was normal isn't optimal. There's a big difference between a normal lab test and optimal, what makes you feel good and able to function every day. Progesterone is a very important hormone for women, not for men. Men should not take or replace progesterone. Men don't make progesterone. They don't need progesterone. It can be very inflammatory, but for women, it's a powerful hormone to protect the brain, the breast. It decreases belly bloat and belly fat. It protects the uterus, protects the uterine lining. Not the same as synthetic chemical progestin. That's a completely different molecule that causes all of the opposite things, increases heart disease, increased cancer, increased stroke. All the things we don't want is synthetic progestin, not progesterone. Progesterone, very, very important for maintaining blood sugars. It's a natural diuretic. It decreases bleeding. So patients that have really heavy periods, that's usually a sign of progesterone deficiency. Amazing for depression and anxiety. So many young women, our practices have on natural progesterone during the day, and it really decreases anxiety. It's amazing for that. Helps with migraines and many, many others. Also understand that if you're suffering from a lot of those symptoms that we talked about earlier, it could mirror other problems. Thyroid deficiency can cause the same thing, even in the presence of normal labs. Chronic fatigue syndrome, fibromyalgia, gut issues, toxicity issues. All of these things can cause a lot of those symptoms as well. And you want to make sure you're with a healthcare provider that will address all of those things if you don't get better when your hormones are optimized. And all of our Avexipel providers are very, very well trained in each one of these things. So let's talk about the different types of hormones. What's the best for men and women? The first kind of hormone that we're all familiar with is oral estrogen or estradiol that comes in hundreds of different formulations. It's a pill that's taken every day. Natural estrogen or conjugated equine estrogen is better than nothing, although oral hormones could have a little more side effect profile, especially the synthetic ones, especially the synthetic progestins. They have a very high side effect profile. So oral estrogen, better than nothing, not my favorite modality, but we do prescribe bioidentical estrogen oral sometimes in women that's what they prefer, or that's the best fit for them. Hormone creams and patches, anything that's put on the skin has the potential for absorption issues. That's the primary thing. And also, the oral hormones and the patches are kind of a one-size-fits-all approach. There's kind of just a couple of doses for every single female out there. So with things that go on the skin, whether it's a cream or a patch, there's absorption issues. Now, bioidentical hormone creams tend to work better if they're applied vaginally for females, or testosterone on the scrotum for males. They have a very good absorption in that way. So understanding that could also be an option as well. Injectable testosterone is, very popular with men. There are some clinics that give it to women. It's not my favorite for women. It tends to have a much higher side effect profile for women. But injectable cypionate is better than nothing for sure. It's not my favorite modality because it can affect and impact liver functions and clotting and things like that, and increase some other problems. But by and large, injectable testosterone is utilized and is safe and efficacious. The biggest problem that we see with injectable testosterone is this roller coaster effect, where a man will shoot up because they usually take it once a week. They get really high and then they drop really low, and then they got to wait for the next shot. So there's some other ways. There's some new dosing that is a daily dose on shots that is also an option that kind of keeps men a little more stable. But my favorite modality is hormone pellet therapy. Pellets are either soy or yam derived. They're considered bioidentical. They've been around since the 30s. They're not new. They were being very highly studied in the 30s in women who had had radical hysterectomies, meaning their ovaries and their uterus was taken out. And then in the 40s, we discovered that women made and needed testosterone and started utilizing testosterone in the pellets. Well, Premarin came on market in the mid-40s, and by and large, pellet therapy as a hormone replacement modality in this country, in the United States, actually kind of fell by the wayside. Other countries, Australia, European countries, they continue to research and develop hormone pellets. And hormone pellets have made a resurgence over the past 10, 15 years in the States because people are looking for better, safer, more convenient options. And hormone pellets meet that in a lot of cases. It's very beneficial for patients because there's no roller coaster effect. So you dose a patient and the levels get up and they stay pretty steady from anywhere between 3 to 6 months, depending on the patient. It's also can be more tailored and individualized dosing to the patient, depending on what their individual needs are than some of the other modalities. It's not just a one-size-fits-all approach. There's many, many variations of doses that can be utilized in patients with hormone pellets. But the convenience factor is the biggest thing that most patients like about hormone pellets. So they come from yams. They're made bioidentically, pressed into a little tiny pellet that goes right under the skin in the fatty tissue, usually in the hip or the flank area, and they just work beautifully. So I'm going to close this very quick, high-level conversation about hormones with a patient. This patient represents so many of patients that we see in our clinics, Avexipel providers see across the country. But this is a woman who came to our clinic here in Texas, and she was about 64. She was married to a retired gynecologist. And she was pretty miserable, and her family was miserable. She was depressed and moody and anxious, and she couldn't sleep. She had no sex drive. She had vaginal pain. She had bladder issues. She had joint pain, all kinds of just the typical problems that you would see in a woman who had gone a decade or more without hormones. And she came in, and we did all of her blood work and looked at her hormone deficiencies and looked at her thyroid deficiencies and looked at some of her other ones like vitamin D and B complex and things like that. And we tailored a dose for her, and we dosed her with hormone pellets. Her daughter actually referred her to us because her daughter had been a patient for quite some time and felt so much better. She really felt like her mom would benefit. So she got the therapy, and about 4 weeks later, when we were doing our follow-up visit, she was in our lab chair getting her blood work drawn, and I saw her, and I said, "Hey, Bobby, how you doing?" And she just starts crying, and tears are coming down, and I thought to myself, I didn't get this one fixed. I messed something up. Right? And she got it together and she said, "No, I just have to tell you, I have not liked my husband for 25 years. And I realize now it was me and not him." And she was completely lamenting the loss of time with her husband because all this time she'd been so angry at him, just thinking he was so annoying. And really she realized the problem lied within her, and she felt so much better. She was lamenting the loss of time with her husband. About a week or so later, when she came back in to go over those labs with her, she brought her husband with her because he needed hormones at that point. And he stopped me and he said, "I just want to say before we begin, thank you so much for giving me my wife back." And he said, "If I would have known about this hormone therapy when I was a practicing gynecologist, I would have put every female on it. Based on the changes I've seen in my wife." And he was lamenting the lack of knowledge that he didn't have when he was a practicing gynecologist, and he was thinking about all the patients he could have helped in a bigger way. But he said at that point, "I need to get pellets too now because I cannot keep up with her from an energy standpoint." And so he did, and they are just a beautiful, beautiful story of not only restored physical health and symptom relief, but a relationship restored. Because what we found over the years is hormone imbalance can occur in men and women at any age. It affects relationships. Not all therapies are created equal. Pellets don't act and work the same as pills and patches and shots. They're all different. Patients have different responses to each one. They're all completely different. They create different side effect profiles. It's not a one-size-fits-all approach. And a big key takeaway that I want you to understand is just because you've been told you have normal labs does not mean your hormones, including thyroid, are optimized. I hope this was beneficial and dispelled some myths, because I'm sure, like many of our patients, everyone wants to live. They want to live their life and not just be alive.